Did you know, aside from being a family planning method, daily contraceptive pill lowers your risk of ectopic pregnancy? It also prevents cysts in breast and ovaries. Well, it's midday and it's time for Contraceptive Matters with DKT Nigeria, your one-stop show that has to do with anything that has to do with contraceptives, simple and safe family planning methods. I'm Olasumbo Modupe, welcoming you to the show. Please stay tuned, the program continues shortly. Thanks for choosing Lagos Weekend Television. Remember, this show is brought to you by DKT Nigeria, one of the largest providers of family planning and private producers of reproductive health products in the country. And basically what we do on the show is to enlighten, not just enlighten, we also encourage families, especially women, to adopt child spacing methods. Simple, safe, and convenient child spacing method. And today on the show, our focus is on daily contraceptive pill. And as usual, I always have two beautiful ladies in the house, a doctor and a media communications manager. First to my left is Dr. Tosin Laleye, a regular doctor in the house. Welcome to the program. Thanks for coming by.
Good afternoon, viewers at home.
And to my extreme left, I have Lara Aluko. Lara Aluko, she's a media and communications manager with DKT Nigeria. Welcome to the program.
Thank you very much.
Thanks for coming by despite the rains and the Owambears in the States.
For the love of Nigerians, for the love of women, for the love of our health, we need to be here every Saturday. So.
Okay, DKT has one of the lowest brand that has the recommended dose of hormones by the World Health Organization. Can you please tell us more about this, doctor? About daily contraceptive pill, Levofem to be precise.
Okay, thank you very much. The Levofem, that's the daily contraceptive pill, is an example of what we call combined oral contraceptive because it has estrogen and progesterone as the active hormones in it. So it consists of a set of pills, usually comes in a pack of 28 pills. The first 21 pills are the active pills, and then we have 7 pills which are just like ferrous sulfate, something to boost your blood so that during your monthly flow you are not, excuse me, you are not predisposed to anemia. So you need to take a pill every day, and we all usually advise that you try to take the pill at the same time every day for maximum effectivity.
Okay, Lara, can anyone use the daily contraceptive pill? Can I just walk into any hospital or do an OTC, over-the-counter drugs before?
No. Let me answer the second question. The question that for you to actually start a daily pill is not an over-the-counter drug. So you need to actually go to your healthcare practitioner. You need to visit the doctor, go to the clinic, the health centers, the hospitals, visit the family planning. You need to talk to the doctor about the fact that you are interested in adopting a method. And once you speak with the doctor, you know, the doctor can now advise as to, you know, if this particular method, if it is suitable for you, and if it is suitable for you, then the doctor prescribe it for you. So basically, if you ask that who can use, if you are a healthy woman, you can actually use the daily pill. You are healthy, you are not obese. You get it. Your doctor has certified that this brand, this method is good for you. Then you can actually take it. And for people that are breastfeeding, the breastfeeding mothers, you know, for you to actually take the daily contraceptive pill, it means that the baby must be 6 months old. You know, we have some method that as early as 6 weeks you can actually adopt. But for this particular method, the baby, for any breastfeeding woman, the baby must be at least 6 months old before you can start this method.
Okay, before we go ahead, I think we should quickly take a short break now. The program continues shortly. Please stay with us. Okay, welcome back. It's still Contraceptive Matters with DKT in Nigeria. And today on the program, our focus is on daily contraceptive pill. And we have been discussing about that briefly. But we have to continue on that. Who can use, we stopped at, who can use daily contraceptive pill and how do you go about it?
Okay, thank you very much. Who can use daily contraceptive pill? Like she said earlier, if you are a healthy person, and then we usually recommend that you visit the health facility so that the medical personnel can actually take a comprehensive medical history, because we don't recommend that women who have heart disease or liver disease or women who have a history of breast cancer, ovarian cancers and all, we don't usually recommend the oral contraceptive pills for them because some of those
cancers,
it's intertwined. With breast cancer, for example, some types of breast cancers are actually, we refer to them as estrogen dependent. That is, the presence of estrogen makes them thrive. So for a woman who maybe has a family history of someone with breast cancer that is estrogen dependent, you would not want, exactly. So you will need to speak with the health personnel. They take a comprehensive history before you can proceed with whatever method it is that you want. And then the way you go about it, there are two ways. You can actually, if you are going to start taking the pills, you can start within the first days of your menstrual period. And if you are starting within the first days of your 3 days of your menstrual period, then you do not need to worry. Once you start taking it, then you can be assured of protection. But if you are going to take it at any other time during your cycle, you will need to use an additional method of protection against pregnancy, for example, condom, for 7 days before the action of the pills can kick off, and then you can be rest assured.
Aside from being a child-spacing method, what are the other benefits?
Yes, other benefits that a woman can derive from the pills. For a lot of women, a lot of women actually enjoy the fact that it helps them to, they usually, for women that have painful menstruation, it can help relieve the pain of painful menstruation. So that's one of the very important uses of the pills, apart from protecting against pregnancy.
What about acne? I read somewhere that it's
yes. I, in fact, that was what I was coming to say, that I know that we've read it, that it also works for acne. Then I know that for daily pill also, for people, for women that menstrual cycle are not really regular. Yes. So it helps to regularize. Yes, it helps to regularize your period. Maybe you are on and off. You know, some doctors can actually place you on that to regularize your cycle. So I know that is another advantage that is outside of our pregnancy prevention.
Okay, it has so much benefits.
Yes, so it does.
How affordable it is?
Oh my God!
Is it actually affordable?
Very.
You know, we usually say that at DKT, what we want is for everyone to be able to afford a method of pregnancy prevention, to be able to afford a contraception pill, device, injection, and so for this daily pill, the level firm, you walk into, after prescription, you walk into any pharmacy you want to buy, you can get it for 100 naira.
100 naira.
Yes.
Anywhere in the state.
Where Sumbo.
I know what I'm talking about.
Well, you know, that is,
Ikorodu, Lekki, Banana Island.
We don't really regulate the price and the environment, but basically we believe that with 100 naira you can get to buy. Now let me put the clause depending on where your area is.
Okay. What about the side effects? Are there side effects, and how do you manage them?
Okay, thank you very much. Definitely there are side effects. Almost every drug has side effects, but the good thing is that these side effects are not very serious things, and they are mild and can easily be taken care of. For example, a woman starting the oral contraceptive pills may complain of headaches, which can easily be taken care of using over-the-counter analgesics, like just simple paracetamol should do. And within 3 to 6 months, most of those side effects actually, once the body has gotten used to having the pill in the system, most of those side effects abate. And then there may also be weight change. And when we say weight change, it doesn't necessarily mean an increase in weight alone. It can be a decrease. It can be a decrease in weight, and it can be an increase in weight. And even the increase in weight is not something, so in a year we expect an increase in weight of about 2 to 3 kg in a whole year. So if a woman is on the pill and she's gaining excessive weight, she should not just attribute it to the pill, like a lot of women do. Immediately I started taking the pill, I just became something else. But no, that is not what is expected. So if you find yourself on the pill and you're gaining a lot of weight, you should actually try to watch what you eat, try to exercise, and try to look for other reasons why you may be gaining weight. Some women may complain about a reduction in their menstrual flow upon commencing the pill, but after a few months that also regularizes, and it's sometimes the menses may not even come at all. Some women complain of that, and that's nothing to worry about, because a lot of people believe that the blood is actually storing up somewhere. And it's bad blood, and it's no, there's
it's going to gush out one day.
There is
I'm sure in the other part of the program we're going to discuss
when we
the
talk
myth,
about the
we'll
myths,
we'll dispel myths and misconceptions, then how to manage it if you miss your dose.
Okay.
We're going to do that. Okay, still contraceptive matters with DKT Nigeria, and we have been discussing contraceptive pill, daily contraceptive pill. It helps to prevent menstrual cramp. It regularizes your menstruation. It also lowers your risk of ectopic pregnancy. It has so many benefits. And when we come back after this short break, we're going to open the lines. I'm sure viewers have one or two things to ask. We would also like to hear your thoughts. Please share your thoughts with us. The program continues in a moment. Please stay with us. Okay, so Contraceptive Matters with DKT Nigeria. This program is made possible by DKT Nigeria, of course, and DKT is one of the largest providers and private providers of family planning products and reproductive health issues, child spacing methods in the country. And for more information about DKT Nigeria, you can log on to www.onionbanana.com. www.onionbanana.com. If you have questions, if you want to share your thoughts with us, send RHS space your question to 38350. RHS space your question to 38350. Our focus today is Daily Contraceptive Pill. We've been weighing the options, benefits, side effects, and other things, all you need to know about Daily Contraceptive Pill. And I have with me in the studio a doctor in the house, Dr. Tosin Laleye, and Omolara Aluko, the Media and Communications Manager with DKT Nigeria. Welcome back, ladies.
Thank you.
And we were actually talking about benefits before we left. Before you continue, Lara, viewers at home, you can call 0908 72966673, 0908 72966673. You can contribute, participate, share your thoughts with us. We would like to hear from you. So, Lara, the benefits.
Okay, well, another major benefit about daily pill, the level from, is the fact that because it's low dose, it doesn't store up in the system. Okay. So it means that once you are off the method, once you are off the pill, your return to fertility is almost immediate. Your chances of getting pregnant is very, very high. So it still boils down to the fact that, and that's why we say that try as much as possible. If you're on this pill, do not miss, because once you are missing 1, 2, 3, that is
on your own.
On your own. It's Sumbo that said it. Viewers at home, not really me. Sumbo said you're on your own, but well, I will corroborate that you're on your own because you can easily get pregnant. So we'll say that return to fertility with this pill is almost immediate.
Okay. So how do you manage? Okay, we've touched on how do you manage the side effect. Is it true? Let's quickly dispel some myths and misconceptions. Is it true that all the daily contraceptive pill you've been using, the all 28 doses, are piling up, or they are blocking somewhere your organs? Is it true?
No. See the way Sumbo is
that is the feedback I get from viewers at home.
Okay, because the way you are putting it to us as if Sumbo believes in this thing that is storing up.
Yes, it's actually a myth. I want to know if it's a myth, if it's a fact or a misconception.
It is definitely not a fact. It is a misconception. Like she said, the dose of estrogen and progesterone in the daily contraceptive pill is low. Back when daily contraceptives first started, the doses of these hormones were high, but with continuous research, it was found out that with lower doses, they can actually still they can achieve pregnancy prevention. So the pills were modified over the years, and then the Levofem actually has one of the lowest doses as approved by WHO. So that's why it's very good. So it doesn't store up in your body, and that is why it's important you don't miss your dose. If it's something that stores up in your body, if you miss a dose or two, then you shouldn't be at risk of getting pregnant. So that alone should tell you that the dose is very little, and every drug we take gets metabolized in the liver, some in the kidney, and then once it does what it's supposed to do, it goes out, and that is why you need to take another one. So it doesn't store up to cause infertility in future, not at all.
Okay. And what if you miss your pill?
Okay, so if you miss your pill, what we'll say is if I miss today and I remember tomorrow, what it means is that I'll take it as at the time I remember, and I'll still take the one for tomorrow. Okay. So meaning that I will have to take the two together. But some people may say, okay, maybe I traveled for 2 or 3 days. Maybe I forgot. I left the pill at home and I forgot. We'll say that you can continue, but you will need a form of protection, extra protection, like maybe the condom, for a period of like 7 days, so that your system can.
Okay, Lara, please hold your thoughts. Hello, good afternoon. Hello, good afternoon. Okay, it seems we lost that call. Please, you can call on 0908-729-66673. 0908-729-66673. So, Lara, please go ahead with your thoughts.
Okay, so what it means is that for that period, because you've missed so many, and like the doctor said, is a low dose, meaning that you are exposed. So while you continue to take it, you need a form of protection. You need a backup plan, so that you don't get pregnant and you blame it on the fact that you are on a pill and you got pregnant. So for that period that you've missed so many, you need a form of protection, but you can still continue with the pill. But the beauty...
Form of protection like what?
Like the condom. For example, you can use the condom as a backup.
How does that work? Because you've missed so many doses.
You know, because
do you need to use another emergency contraceptive?
Well,
you go see your doctor to confirm if you're pregnant already. No, I just want to know.
Okay.
I just want you to enlighten me.
Okay.
Hello, good afternoon. Hello, good afternoon. Welcome to Contraceptive Matters. Hello, good afternoon. What's your name, please? Welcome to Contraceptive Matters. Loretta, welcome to the show. What's your question?
I want to have is that possible to deliver a child?
Okay.
That child is almost 3 months.
Okay.
That person has not seen his menstruation.
Oh.
Can that person start to use this?
Okay, Loretta, thank you so much. So, doctor,
thank you very much for your question.
Touch on that.
Yeah, you have a baby. The baby is about 3 months. You're not seeing your menstruation yet. Yes, that can happen, especially if you are breastfeeding exclusively. It takes a while for your menses to come back. You can use methods of contraception, but not this pill. Like she said earlier, your baby needs to be at least 6 months old before you start on the pills. But there are other methods that you can use. So you just need to visit your health facility, and the health personnel will enlighten you on other methods that are suitable for you, because your baby is just 3 months.
But how true is it that breastfeeding is also a form of child spacing? Is it true, doctor?
Well. What happens with breastfeeding is that most of the time when women are breastfeeding, especially when they are breastfeeding exclusively, you are not likely to ovulate, and then you may not see your menses. But it is not 100%. I've seen women who got pregnant with babies about 2 to 3 months old, simply because they thought they were safe. After all, my menses has not returned. They say it's safe and all of that. So that is why we advise that whether or not your menses has returned, you should still pick up a contraceptive method, so that you can be very sure that you are well protected. Yes, breastfeeding protects you to a certain degree, but we never know who is not 100% protected. So to be on the safer side, just adopt a method suitable for you.
Okay, Lara, before that call, I actually asked what other form of protection can you use if
you miss your pill? You can use emergency pill too. You can use emergency pill, while you can use the emergency pill as a backup plan before you continue and stabilize. You know I said the other time that for a window of 7 days you need to protect yourself. By then you are taking it, but you need it to kick into action very well in your system. And because it's low dose, it takes time. So because of that, that's why you will need the backup plan.
Okay. Can I just add something to that? Well, if you've missed it for a couple of days, you only need to take the emergency pill if you engage in sexual intercourse.
Yes.
So if you've missed your pill for 3 days and you've not had intercourse, you just need to pick it up. But you know that for the next 7 days before your full protection will kick in. So if you are not having intercourse during those days, then you don't need the post pill.
Okay.
Yes.
So to avoid missing all your pills, can you share simple tips?
Okay. Looking at to avoid missing it, number one, you can actually set alarm on your phone, or set alarm. You can ask your partner also to set the same alarm. For example, if my pill, I'm taking it by 7 p.m. every day, I'll set alarm for...
Must you take it?
Yes. The reason is that
take it in the morning or at your convenience.
Sumbo, like you told them the other time, you're on your own. If you take 7 p.m. today and you take 7 a.m. tomorrow, you are on your own, Sumbo. But what we are trying to say is that take it at the same time, because it's low dose. It needs to be in the system, you know, the way it works. It needs to be in the system. It's just like a 24-hour thing.
Exactly.
So when you take for 7 p.m., by 7 p.m. tomorrow, it has run out of the system. You need to refill. It's just that way. So what we say is set the alarm. Let your partner set the alarm also for you. Then even the tablet, you can put it you can put the sachet at places where you regularly visit in the home. For example, maybe by your dressing table, you have it there. You have a bottle of water there that you can, you know, use to take it. So, you know, these are tips. Then you can have a calendar in the room. Put up a calendar. You are ticking it off as you are taking it on a daily basis. You get it, so that once you know that, oh, if you are missing, you can see on your calendar that, oh, this date is not ticked, meaning that you've missed. So one way or the other, all those things will help. Even your partner, by setting it, or you know, setting alarm for you, we even, you know, remind you that, honey, baby, you've not taken your pill.
Hello, good afternoon. Lara, please hold your thoughts. Hello, good afternoon.
Hello, this is
Shola, good afternoon. Welcome to Contraceptive Matters. Can it what?
To stop fertility of the woman.
Okay. Okay. Is that all, Shola? Thank you, Shola, for calling.
Okay, we've actually said that before, so I'll just say it again. No, the pill cannot disturb fertility. Like we said, the dose is very low. So the moment you feel you're ready to get pregnant and you stop it, you should be able to get pregnant. The drug doesn't accumulate in the body. So if after stopping the pill you are having issues getting pregnant, please visit your doctor. There are a lot of other reasons why a woman may find it difficult to get pregnant. So you will need to be properly investigated to know the real reason why you're not getting pregnant. And if I may add another tip to how you can remember your pill, these days of social media and all, if you have a group of friends also on the pill, you can form a WhatsApp group. These days, there are so many WhatsApp groups. Yes. Yeah, it's as serious as that, to prevent unwanted pregnancy. So, excuse me, if you have a group of 5 friends using the same method, you can form a WhatsApp group and remind each other.
That's funny. Okay, viewers at home, you can call, you can participate on 0908 729 6673. 0908 729 6673. Not 09094. 0908 729 6673. Hello, good afternoon. Hello, good afternoon. Welcome to Contraceptive Matters with DKC Nigeria. Your name is what? Okay, we lost that call. Please keep calling. You can call, join us 0908 729 6673. 0908 729 6673. Before that call, you were saying something about, you were giving us tips, sharing tips on how to avoid missing your pills, Lara.
Yes.
So apart from the WhatsApp group, the doctor recommended, and it's quite funny, but you know,
it's helpful.
Whatever works for you.
Some.
Okay.
Then you can also incorporate it into your daily routine. For example, every day at least you brush your teeth. Maybe in the morning, you brush at night also. So it could be at that point. Make it, you know, by, you know, someone said that whatever you do as a routine for close to 3 weeks, 21 days, like it becomes an habit. You get it. So once you add it to
some people are not used to it. When it comes to medication, some people don't just dig it.
Okay, but I would say that if you know what the risks are, then I think you should be able to avoid the risk. I think it's something you should be able, you know, you should hold as very, very important. Is something that you should see as very imperative for you to do. So incorporating it into your daily routine will also help, you understand, in you not missing the pill.
Hello, good afternoon. Hello, good afternoon. Oh, we lost that call. It seems the network is bad, maybe because of the rain. We've been discussing contraceptive matters, daily contraceptive pills to be precise, and we've weighed the options. daily contraceptive pills actually prevents any gynecological form of cancer. It lowers your risk of ectopic pregnancy. It regularizes your menstrual flow. It also prevents menstrual cramps. Dr. Tosin Laleye and Omolara Luko, the media and communications manager, have been doing justice to that. It's been so wonderful to have you guys on the show. And thank you so much, Shola, Loretta, and I think Cynthia tried to call. Please join us again next week where we come up with another interesting package. This program is brought to you by DKC Nigeria, and our major focus is to encourage positive disruptions in statistics in maternal mortality rate to be precise. We encourage child spacing period method. We also encourage pregnancy prevention, simple, safe, and convenient pregnancy prevention. So please stay with us. Join us again next week when we bring you another important and interesting topic. My name is Olasumbo Modupe. Thanks for watching.